Okay, good afternoon, everybody. I am recording this from my office. This is the clinical skills orientation for the wonderful Integration Foundation. And I tell you why this is so wonderful, because this Integration Foundation, which is the final pre-clerkship foundation of the undergraduate medical education, has gone through quite a whirlwind of changes and unforeseen circumstances. So we are very excited to organize this and get this to you in an orientation video. If you're listening to this, this should be for the clinical skills preceptors. There will be 2 preceptors per each medical foundation group. I am Jason Profetto. I'm the chair of the clinical skills, and I oversee the OSCE as well. And this is for basically the spring, summer of, I guess more the summer of 2020, the Integration Foundation. And the Integration Foundation starts on July 2nd, I believe, and it goes all the way to September 25th. So first and foremost, I really want to say thank you. I want to say thank you to everybody that has actually committed to teach, has put forth a lot of effort in their enthusiastic ways of responding. We had hundreds of people, our resident preceptors, that were very keen to teach. About 100 of them, I think it was between 90 and 100, were committed to teaching both the Integration Foundation and MF1. And I think that just says so much about our resident group and our teachers as a whole in terms of what they're able to do and what they want to do. Our students have provided very strong feedback that part of the Integration Foundation that they think would be best would be to have resident preceptors teaching clinical skills. I agree with that. I mean, that's why we run clinical skills the way we do. And again, just a big thank you to everyone that is teaching. This is going to be a little bit basic, right? But I want to just go over some really rudimentary things for everyone that is teaching in the Integration Foundation, just so we're all very clear from the get-go. This is for clinical skills. Clinical skills is really a focus on history taking and physical examination. Now, the obvious issue that everyone's going to run into is that, yes, obviously we can teach history taking virtually, but the physical examination is always something that's a little bit more challenging unless we're there in person. And this is something that we've been grappling with over the last few months since the whole COVID pandemic has started. And I'm going to get back to that in a little bit, but I really want to just hammer down this point that the clinical skills is a focus on teaching, practicing, rehearsing, practicing, teaching again, practicing, teaching and practice and practice and practice. The clinical skills, history taking and physical examination. Yes, there's a little bit of chalk talk. Yes, there's a little bit of presentation, a little bit of didactic stuff. Yes. But the focus, the bulk has to be on the practicing of history and physical examination. Now, so normally at McMaster, we are divided between pre-clerkship and then clerkship. Pre-clerkship has 5 units. The units are called medical foundations. Formerly, they were called medical foundations 1 to 5. And MF4 was a little bit more integrative. And MF5 was MSK neurology and brain and behavior psychiatry. We have switched things. So we have MFs 1, 2, 3, and 4. MFs 1 is respiratory cardiac. Introduction to medicine, respiratory and cardiac examination. And then MF2 is hematology and renal. MF3 is endocrinology, GI, and reproduction. MF4, the former MF5, is MSK, neurology, and brain and behavior. And then the final medical foundation, formerly known as MF5, is now going to be called the Integration Foundation. The Integration Foundation is a change. This is the first time that we've ever taught the Integration Foundation. The whole thought is that we took hematology. We took oncology or neoplasia and infectious disease or host defense out of MF4, and we've put it in a bit more of a longitudinal way in our pre-clerkship curriculum. Then when it comes to the Integration Foundation for Clinical Skills, what we wanted to do was integrate in 3 different ways. We wanted to first integrate across all the different MFs. So that means all the content that is being taught from MS1 to MF4 is going to be spiraled back and taught again in the integration foundation. That's level 1 of integration. Level 2 of integration is we want to integrate with the different parts of the curriculum, specifically medical decision making, professional competencies, and the tutorials. So what you'll see is that there's a bit more of an explicit effort to integrate with those different parts of the integration foundation. So things should line up in such a way that they reflect and complement things that you will be looking at in professional competencies later on, things that you will actively be looking at in the medical foundation, and things that you'll be learning about in medical decision making. It's never perfect, and it doesn't have to be perfect, but the point is that there's a deliberate attempt to complement. And then the final level of integration is integrating cases within the actual integration foundation itself. So you'll see there's patients and standardized cases that we talk about in weeks 1 that get talked about again in weeks 4, week 6, and weeks 7 or 8 or beyond there. So there are things that get spiraled even within the actual integration foundation itself. Now, the other major change that has been unforeseen and for sure unprecedented is this major virtual transition as a result of the COVID-19 pandemic. So as of March or mid to late March, we have not been teaching clinical skills or any medical curricula in the actual university live and in person. All of it has been done virtually. So the Integration Foundation, which was normally supposed to be in the fall, so it would start in sort of end of August, early September, was supposed to be delivered live. And we are not doing that. It is going to be entirely virtual as a result of physical distancing and public health guidelines. And it's going to start in the beginning of July, so just in about a week and a half, 2 weeks from now. It is going to be delivered virtually, which means there's a couple of changes. Forgive us. Do the best you can with your patients with the program. There's been a lot of changes, and we've been putting in a lot of work to become as updated and dynamic as possible given the current landscape. So the Integration Foundation is a foundation that we integrate prior material as well. I've explained the 3 levels of integration. The Integration Foundation too, I'm going to get into this a little bit with the coming slides about structure and function, but the way clinical skills is going to be delivered in the Integration Foundation is that it's going to cover some of the core content or core themes that are going to be delivered. So things like maternal fetal care, palliative care, complex chronic care. These are some of the major themes that are going to be a bit more pronounced in the Integration Foundation. Clinical skills is going to complement a lot of different areas because it is exactly where we should be integrating. Whereas the core content in clinical skills has been covered from MFs 1 to 4, this is the foundation where it all comes together and gets applied, reviewed, practiced, and we do this through various cases and various levels. So clinical skills is going to be delivered virtually. So this means that instead of meeting in person, you are going to have scheduled clinical skills sessions, which will be once per week. They will be scheduled with yourselves in your group. They will work around call schedules and other mandatory activities within the undergraduate program. The virtual stuff also includes some details about what platform you're going to be using to communicate with your students. Within the platform, how can you set up different virtual rooms so that other people are practicing? How can you do it so that you can observe? How can you do it so that you can even schedule things like little mini OSCEs, right? There's all sorts of stuff, but virtual clinical skills is a whole category of pedagogical delivery that is going to be new. With the materials you're going to receive, including this video, we are also going to provide you with some tips and tricks that are integrated with some feedback from our medical students and the rest of the curricular teams. So you're going to get a lot of specific feedback and tidbits and pearls on what's the best way to deliver virtual clinical skills. That all being said, a lot of our residents have been teaching in different ways virtually, and there has been a lot of creative ways and innovative ways of doing this. So my advice would be, yes, do what you think is most appropriate, creative, listen to feedback, and really try to do it in the best way that you think possible. Clinical skills will be weekly. The integration foundation was formally 12 weeks, but there's a middle week that's going to be used as a vacation week. There are still 12 weeks of clinical skills to be taught. So at any point, you can actually double up or just integrate some of the content into another week. It is going to be once a week. It's going to be a 2 to 3 hour session. There will be multiple sessions where your group will have a booked standardized patient. The standardized patients will be directly trained. There's scripts that are written and created that will reflect the content that is supposed to be delivered in that given week. It's very important that you come to these sessions as prepared and organized as possible with a good attitude, a smile on your face, and you would be amazed at how far this goes. But remember, like the structure of clinical skills, as I said at the beginning, and I reiterate this now, is really supposed to be focused on the teaching and practicing of histories and physical exams. Obviously, you can't do physical exams on one another, but we can still do them in ways where people are on camera. They can practice the abdominal exam, for example, on a pillow. They can practice the cardiac and respiratory exam on pillows that are standing up on chairs. You can show things on one another that within an appropriate level, etc. So there's a couple of things that are going to be unique and novel given the changes, but the structure and function of the clinical skills is still going to be the same. Weekly sessions for the 12 weeks with that 1 week of vacation, in which you don't teach clinical skills, you just add it on to another week. The other thing is that there are going to be 2 resident preceptors assigned to each group. The groups, as I understand, are still going to be specific to their campus. So Waterloo students will be with Waterloo students, Hamilton students with Hamilton students, and Niagara students with Niagara students. So the groups will be 2 resident preceptors, and there will be 6 to 8 people in size, and they will be specific to their medical foundation groups and their campuses. The schedules, as I said, are going to be prearranged. These are things that are going to be booked so that we keep it as consistent as possible. And that is already in process with our administration for the clinical skills curriculum. The content, so as I was saying before, this is going to be a review of multiple things that you've learned to date. It will seem like a fairly large mix and with quite a bit of variety, but these are things that are going to be taught and reviewed so that we can spiral from things that we've learned before and how we're going to actually practice them now. So how to teach and what to teach. Now, I just want to stop for a second here and go to the clinical skills guide. So maybe what I'll do is I'll go back to MedPortal. If you go to MedPortal and you go to the undergrad medical foundations, you'll see the integration foundation. And then there's all sorts of things that are going to be prepared here. But if you go on the right-hand side here, you'll see the McMaster Clinical Skills Guide, the Integration Foundation Guide. So if you click here, you will see the Integration Guide. And as you go down, there will be a lot of introductory material. This is fairly standard. There's a lot of different hyperlinks, a list of all the editors and people who have made contributions to date. And then you'll have the actual Integration Foundation Weekly Session Guide. So you'll see each week which cases are taught and what the topics are. So melena stool, knee pain, headaches, gout, an individual, a female to male, trans visit, gender affirming surgery. So there will be some anesthesia related stuff, and as you go down you'll see all sorts of different things. So there's things from oncology and breast, there's things from new babies, diarrhea, left ear pain, contraceptive counseling, etc., kidney disease, LTC, or long-term care. So you'll see that there are a variety of different topics and ways in which they're presented. You'll see too that, for example, like here's case 1, and case 1 will show up again in week 2, and you'll see like where's case, so case 7 is a prenatal visit, and then case 7 will show up again, and it's an individual that's experiencing urinary incontinence, for example. So when you click on any of these, it will be hyperlinked, and this is the actual schedule with each week and what's covered. And if you go over here, you'll see the different parts of the pre-clerkship in terms of what content is covered and how it's mapped. So this is all very deliberate. If you click, let's go to the first case, for example. So you'll see that this is where the schedule comes in. So integration foundation week 1, case knee pain. And you'll see like there'll be a standardized case. There's a stem for practice. This is where the actual standardized patients that will be booked and organized for your sessions come in. There are JAMA articles to review. And these are articles that are supposed to integrate and blend in medical decision making and epidemiology. When a JAMA article is attached, the goal is not to go through all the details, but to go to the bottom line and integrate it into the discussion in a bit of an evidence-based way of how, for example, you discuss knee pain or the approach to monoarthritis or something in that capacity. And same thing with headaches and so on and so forth. There are direct observation checklists or for clinical skills, the docs checklist form. So if you click here, you'll see that there's a way that you can do the actual observation for a student, and then what will happen is they'll get the feedback. This is not a mandatory thing, but it just gives an opportunity for students to get direct observation, and then people can actually use this to track what they're learning. And as I'm just going to go back to the top here because that brought me all the way to the bottom. But if you go back here, you can look at the different cases that are going to be presented. You can look at the different things. I just want to see when we use a pro-comp connection. So you'll see like integration foundation week 4, case 5, we're talking about lymphadenopathy. And so the pro-comp connection is about HIV-related stigma. And what you'll notice here too, and I think we get to this in the presentation, is that our clinical skills, we've made a tremendous effort to be to include diversity and be inclusive of varying populations that may not otherwise have been taught previously. So there's some specific stuff around trans communities, trans people. There's the HIV related one. And there's even individuals or people with disabilities, people of varying skin tones and skin color. So you'll see a lot of different things in our clinical skills that are as inclusive of diversity and varying populations, right? So as you go through, there's a lot, and again, if you go back to the schedule, you'll see all sorts of different things that are going to be covered. This again is just an example. So when you look at the physical examination, we will do things. We organize it in specific things that you can see, why you would check, maybe some tips for what to say on like an OSCE scenario. We have some modification in here for people of diversity, right? So if someone has an increased body habitus, how that might change the way you need to check for pulses, for example. And there's a couple of things like that as you go through this guide. Now, I mean, the guide is pretty big. This is for Integration Foundation, and it's 58 pages, but for the entire undergraduate program, it's a 400-page document, right? And there's all sorts of material. But again, if you go to the actual where are we here? The actual schedule, you'll see everything and what you need to do. Okay. Now, I'm just going to go back to this, for example. So there are going to be standardized patients involved. You're going to be getting standardized patients. It'll be scheduled for you. You'll be aware of all these details on multiple weeks. Our standardized patients are being trained for virtual sessions. That means you will literally connect. Like if you connect on Zoom, for example, they will meet you there, or you will be able to connect with them and teach with them and have students practice on them. And that's going to provide you, you're going to get a little bit of an idea of how that works shortly. The clinical skills manual is what I showed you. And, what are students saying? I put this here because it's been tough for students. This has been a big change right in the middle of their medical school education, and this has caused a bit of anxiety and apprehension for a lot of the students in the current first year class that are doing this content. if you're organized, you're enthusiastic, you're open to learning on the go and being as dynamic and innovative as possible, I'm going to send you guys some documents with feedback from students. I think it's really, really helpful. But students love clinical skills. They really enjoy getting taught by the resident preceptors. They really, really find it quite helpful. They think that it's actually one of the better experiences that they're having. And I think that's a really, really important thing to know for the actual preceptors coming in. There's going to be evaluations. There's going to be a mid and final evaluation. Make sure before the evaluations you're able to observe the students and speak to them as much as possible. I would strongly recommend that you give feedback and observation as much as you can given the limitations each and every week. And then when the mid-unit evaluation and the final evaluation come out, the students will not be surprised when you actually give them feedback. Now, we're also going to be doing LGS. So these are active learning large group sessions that are specific to clinical skills. These will be delivered in a weekly fashion. They're going to be 1 hour each. These are independent of the weekly sessions with the small groups and resident co-preceptors. But the active learning large group sessions are going to be on topics like ophthalmology, dermatology, ENT, some prenatal, pediatric, palliative ones as well. So just to make you aware of that. There's going to be, as I was showing you, medical decision-making and professional competency connections. This is an integrative effort. This is also an attempt to make sure that we are touching on other parts of the curriculum that are related to clinical skills but might not be explicitly taught. That's why you'll see things like JAMA articles integrated from one week to the next. You'll see things like professional competency connections or moments. We strongly encourage you to use these for what they are. Integrating them into a week, making a good, fruitful discussion come from them is really, really helpful, and I think that would be definitely worthwhile. Diversity and inclusion is obviously very important to us. Just to give a bit of a background, I think most people will know this, but at McMaster in clinical skills about 4 years ago now, we did a big needs assessment. We did formal study of diversity and inclusivity in our clinical skills. We identified varying things and items that we really wanted to be much more inclusive about, different populations that we felt were underrepresented, different techniques and pearls that we thought would be useful. Just for example, if there are people of varying skin tones, we want to make sure that that is included when we're talking about how to diagnose melanoma. Or for example, when you're doing genitalia exams, how do we include individuals from the trans population? And what does that mean for the prostate organ, that gland? Does it change things or not? And how do you adapt? Just for some examples. The first year OSCE, which is normally in June, which is normally in 2 days from now, has been rescheduled, is going to be mid-integration foundation. I hope that each and every preceptor signs up to be an OSCE evaluator. We are going to have a virtual OSCE, believe it or not, the first virtual OSCE. It's going to be delivered with something called Simulation IQ, which is a virtual platform that is designed specifically for OSCEs. It's very interesting, the stuff that we're doing. That is going to be in the final week before that midpoint where the students get a vacation. So I want everyone to be aware that there is going to be an OSCE in this foundation. And just listen, a few final words, because my next slide is a thank you, but a few final words. There is a ton of stuff happening right now with the transition to virtual clinical skills. No one in the continent in North America has extensive experience in this. A lot of institutions are being as creative and adaptive as possible. This is not going to be perfect. So don't send me hate mail because you're upset that we don't have all this experience with virtual clinical skills. I am sorry, we do not. And one of the things I was joking around with the students is they were a little bit nervous about doing virtual OSCEs and clinical skills. And I said, listen, I'm doing virtual medicine right now with my patients, and I've never been formally taught how to do virtual medicine. And we don't even have a lot of guidelines with the CPSO in our colleges. So There is no easy way to make this adaptation. We are all doing it the best we can on the fly. And what I would strongly recommend is be enthusiastic, be positive, be optimistic. As Abraham Lincoln says, the best way to predict the future is to create it yourself. Don't be reactive. Don't wait. Do it yourself. Give me feedback. Come up with stuff. But remember, this is a focus on clinical skills. On that note, I don't want to keep this too long, but thank you so much. You're going to get some information from us. If you have any questions, concerns, hurdles, anything, email me, and I would be more than happy to chat. Thank you very much, and we will be in touch soon. Thank you.